Hi, everyone, and welcome to today's webinar. Glad to have you joining us today. I'm Sarah Brandspiegel. I'm an instructor at the Colorado School of Public Health, where I work with the Program for Injury Prevention, Education, and Research, also known as PIPER. And I facilitate the National Peer Learning Team on Child Maltreatment Prevention, which is a national network of people working in public health and social services who come together to learn about primary prevention approaches to child maltreatment. The project is funded by the CDC, and it's a partnership between PIPER and our colleagues at the Colorado Department of Public Health and Environment. And we're very excited today to host the 6th in a series of research and progress webinars on preventing adverse childhood experiences and child maltreatment. The focus for today is economic stability and its relationship to child maltreatment, which is a very timely topic given the economic strain that we're seeing with the pandemic. I'm pleased to welcome you today. I'll go through some quick housekeeping slides and then we'll get started. So please use the Q&A feature in Zoom to ask any questions. You can also use the chat feature if you're having any issues that you want to raise. The session is being recorded. We'll share a link after, not immediately after, but in the coming weeks, likely we'll be able to share a link with the slides and post that to our website. So stay tuned for more information about that. And please complete the feedback survey at the end of the session. That's an opportunity to tell us what you liked, what you didn't like about the format of our webinar, and also any ideas you have for future webinars in this series. I wanted to let you know that our past webinars are available on our website, and I'll put the link in the chat in a moment. But you are welcome to check these out. They covered a range of different topics: gun violence, organizational policies to prevent child sexual abuse, upstream community resilience work, lots of different topics. And I hope you'll check those out if you missed any of those. And also, I encourage you to register for our upcoming webinar in December, looking at community level interventions to address ACEs. It'll be on December 8th. We always start with some quick polls, so I'm going to open those up for you to share with us, what sector do you primarily work in? And to what extent is child maltreatment and ACEs prevention a part of your professional role? So please take a moment and do that. All right, I see votes are coming in. I'll just give it a few more seconds for everyone to vote. Great, so let's share these results. So it looks like most folks are coming from public health, 46%, or social services, 25%. And we also have people joining us from nonprofits, research and academic institutions, and a few from medical care and K-12. So that's great to know where everyone is coming from. And to what extent is child maltreatment and ACEs prevention a part of your professional role? Looks like the most common answer was that child maltreatment and ACEs prevention is some of my role, 54%. And that I think is pretty typical, that we see that people, wear a lot of hats and are juggling lots of different violence prevention topics or a range of different areas that they work in. So that's good to know as well, that people are working on child maltreatment prevention, but it may not be their entire role. So thank you for sharing that. And now I'm pleased to introduce our presenters today. So we have Ali Rowhani-Rahbar, who is the Bartley Daub Endowed Professor for the Study and Prevention of Violence at the University of Washington. He is also the co-director of the Firearm Injury and Policy Research Program, leader of the Violence Prevention Section, and director of the Research Corps at the Harborview Injury Prevention and Research Center, and a real leader in the field. And we're very pleased to have you here today. And I'll also introduce Nicole Kovski. She's a PhD candidate at the Evans School of Public Policy and Governance at the University of Washington and has been working on this research topic as well. So thank you both so much for taking the time to share your research with us today. And I will turn it over to you to pull up your slides.
Thank you very much, Sarah, for that kind introduction. And I think Nicole is going to now share the slide set. Great, wonderful. Thank you very much, Nicole. And please let me know if you can't hear me well or you can't, or there are any video or audio issues. So again, thank you so much to Sarah, to all our colleagues, Colorado School of Public Health, all others who really made this talk possible. It's a great pleasure and opportunity for all of us to engage in this conversation about this really important topic and really learn and share some of these findings about one of the projects we've been doing with you, but also learn from you and see what kind of thoughts or suggestions you have about this line of work. The next slide, Nicole, thank you. And this, as many other efforts in our field in general, whether we are in public health or social sciences or biomedical arena, can't possibly happen without really team science. And we've had many colleagues from around the University of Washington, around the country, who've provided feedback for this work. You see some of their names here. And this was made possible by a UO1, a collaborative agreement with the Centers for Disease Control and Prevention. A couple of years ago, CDC provided an opportunity for funding for projects that look at one policy in relation, the effect of one policy in relation to several different types of violence, one of which was child maltreatment. So the work that Nicole will be presenting in about 15, 20 minutes is the work we did with one of those policies, earned income tax rate policy, in relation to child maltreatment. But before talking about that specific relationship or association for policy and child maltreatment, let's take a step back, and next one, Nicole, and talk about different forms of violence. Because as you know, many of you are leaders in the field, whether research or practice or both of them. You know about the intersectionality of different types of violence. The CDC, Division of Violence Prevention, has done an outstanding job in terms of delineating and outlining some of these intersectionalities. And they really have put efforts and have made investment both on practice and research side to really understand shared risk and protective factors for different forms of violence, because they do, different forms of violence that you see here, they do share certain risk and protective factors. So today our focus is going to be on the blue arrow here, but that by no means does it mean that other forms of violence are not impacted by some of these policies or broader level programs that we will discuss. The next one, Nicole. So again, for this informed audience, many of you are familiar with the socioecologic model, different layers of this onion, if you will, from the very, very center of it to very broader societal level factors. And I've highlighted here just two of those two of those factors, two of those levels of risk and protective factors. One of them is the relationship one on this slide, and the other one is the social one on the next one. And you can see for different types of violence, whether it's child maltreatment or intimate partner violence or sexual violence or youth violence or suicide, the CDC, especially through the Connecting the Dot program that some of you may have seen on their website, they have delineated different risk and protective factors that may have a bearing on different forms of violence. These are those that have something to do with relationship level, social isolation, poor parent-child relationship, family conflict, economic stress, and association with delinquent peers. The next one, Nicole. But then taking a broader look at this, you can see that at the societal level also there are many programs that may have a relationship with some of these outcomes. And economic and social policies and programs are one of those. So focusing on child maltreatment, the next one, Nicole, the question comes up, which is essentially, well, yes, these programs might be associated with child maltreatment, but which programs are associated with that? And what do we learn from that association? So a couple of years ago, some of our colleagues worked on the relationship, examined the association between child maltreatment in states with Medicaid expansion versus states without Medicaid expansion. And they published that in JAMA Network Open. In a very thoughtful commentary by Dr. Christine Campbell of University of Utah, she mentioned that while the programs that seek to prevent child maltreatment as a primary objective or outcome are incredibly valuable, we shouldn't forget about potentially policies, social policies, economic policies that maybe were never designed to actually reduce child maltreatment per se, but as a spillover effect, as an unintentional effect, as an unintended happy beneficial effect, they may also reduce the rates of child maltreatment. The next one, Nicole. So she wrote, for decades, many have hoped for a comprehensive approach to the primary prevention of child maltreatment. Over and over, we are presented with early evidence of program efficacy. Effectiveness may be established, followed by the challenges of replication, fidelity, and adaptation required for widespread implementation. Many of these programs provide meaningful and needed services to vulnerable families around the country and are sustained by local champions and variable funding streams. However, for state policymakers tasked with the almost impossible charge of balancing the needs of young and old, vulnerable and comfortable, and healthy and sick populations, this parade of child maltreatment prevention program may appear to provide marginal benefits to a sliver of constituents with a substantial upfront investment to be recovered only over the course of a generation. Next one, Nicole. And so the question is, while these programs are incredibly valuable, and many of people in this audience are probably involved in those, the question is it possible? Is it plausible that child maltreatment can also be prevented as an unanticipated bonus of social or economic policies that were never actually designed to directly impact child maltreatment? The next one, Nicole. And so we sought to examine the impact of one of these many policies that are available in the United States, both at the federal and state level, on the impact on the rates of child maltreatment. And the policy that our group chose was Earned Income Tax Credit, or EITC. And several of the audience members may already be aware of EITC, but I'll just very briefly and broadly talk about it, and then Nicole will go into much more depth momentarily about EITC. But EITC is one of those cherished programs with somewhat of a bipartisan support, both among Democrats and Republicans, that has been credited with lifting millions of children out of poverty. It's one of the largest cash transfer programs in the United States, specifically targeted toward low-earning working families. And they receive this cash or this credit as a fraction of their earning, as you see in this slide. So the x-axis is earnings, the y-axis is the credit amount. And as you can see, it's really a function of several different features of the family. So number of children, marital status, and of course, earnings. And EITC has this interesting looking odd and unique shape, as you see, which with a phase in, with a plateau and a phase out shape, as you see here, that really is a function of those factors I mentioned to you. And so a household with 3 or more children can, as you see on the very top, receive more than $6,000, for example. And that's a substantial amount of money. For those with no children, as you can see, the amount of credit is much less. And after earnings go beyond certain level, depending on family structure and these factors, it completely disappears and phases out. The next one, Nicole. And so that was the federal EITC. In addition to that, now since 1980s, different states have opted for the supplemental EITC, which is the state EITCs, which provides, additional bonus as a fraction of the federal EITC. And like many other opportunities that we have in both research and practice to really utilize this beautiful natural experiment that we have in this country, we can use quasi-experimental approaches to look at the effect of EITC adoption on different types of outcome. And in fact, people in health sciences and social sciences have been studying EITC for some time, and in relation to a variety of different social outcomes. Some health outcomes have also been studied, but not many violence-related outcomes have been studied historically in relation to EITC. EITC could be refundable or non-refundable. Most of them are refundable. The definition of refundable is on this slide. Is the refundable earned income tax credit give working households the full value of the credit they earn, even if it exceeds their income tax liability. Non-refundable doesn't go beyond tax liability. And some research so far has shown that non-refundable EITC really does not exert a beneficial impact on health, while refundable EITC, when you actually receive cash above and beyond your tax liability, does exert beneficial impact on health. The next one, Nicole. So for the purpose of this proposal and this research, we developed a theory of change model, which was essentially articulating and delineating causal mechanisms by which we postulate EITC may exert an effect on different forms of violence. Of course, this talk today is about child maltreatment. And again, like any other theory of change models or conceptual models, is subject to criticism, subject to change and refinement. But the idea here is that this bifurcation you see on the top means that EITC essentially exerts its effect mostly through these two channels of promoting employment and providing income. And while those things are impacted or influenced by EITC, then they have their own downstream effects and a variety of different things that they have with social, emotional, physical, and mental health and well-being. At the center of it are things like stress or family time, et cetera, et cetera. And you can see through those mechanisms, they may have some influence on some of these outcomes. For child maltreatment, we postulated that some of them may go through stress, the relationship between parents, other tasks that, let's say single parent may need to do, and you will see some of those on the next slide. The next one, Nicole. And so while we know that EITC does impact things like poverty, maternal stress, the question is, well, those are all valuable efforts that have been done in the past, but what if those are intermediary or intermediate outcome on their relationship in this causal pathway to the ultimate outcome of violence, here, child maltreatment? So does EITC actually reduce child maltreatment, and how could it do so? Well, as I mentioned to you, maybe by things like affecting parents' ability to provide children's basic needs, or the ability to pay for adequate childcare, or maybe their health and behavior and reduce their strain, or essentially promoting a healthier family relationship. So with those in mind, we sought to actually empirically study the impact of EITC on child maltreatment. And I will stop here, and Nicole will take over to discuss with you this very specific project that we conducted.
Great, thanks, Ali. So I'll start by providing some additional information about the EITC and its relative size or importance among the federal programs that provide assistance to low-income families in the US today. So this figure shows the number of individuals that are served by federal programs in orange, and expenditures on those programs in blue. And the largest programs in terms of the number of individuals served are SNAP, which provides assistance to purchase food, and school lunch programs, followed by the EITC, which reaches approximately 28 million individuals annually. And then there's TANF, which provides cash assistance and is traditionally what we in the US think of as welfare. And TANF is a significantly smaller program than the EITC is today. So in addition to reaching many families, the EITC also has a substantial impact on poverty in the US. So for example, in 2018, the EITC raised the incomes of working families in the US such that 5.6 million people were lifted above the federal poverty line. And this number includes 3 million children. So as Ali mentioned, there's a body of evidence which continues to grow that the EITC has positive spillover effects on certain health outcomes. And the benefits have been found to be the largest for single mother families and families with more children, who are more likely to be eligible for the tax credit and who on average receive larger credits. So the health improvements that have been linked to the EITC include reductions in low birth weight births, reductions in infant mortality, reductions in chronic stress and depression. And it's possible that some of these health outcomes that are improved by the EITC could lie on the causal pathway from the EITC to child maltreatment, for example, reductions in stress and depression, or that they could share similar causal pathways that connect social factors to health outcomes. So although child maltreatment has been well documented, to be linked to serious mental and physical health problems across the life course, as well as being disproportionately experienced among children living in poverty, to date, there have actually been relatively few studies that have empirically examined whether the EITC impacts child maltreatment. However, there is growing recognition, of course, as this talk indicates, across the public health community that child maltreatment may be impacted by the EITC, despite there being few empirical studies on the topic. So this is a list of studies that have investigated the link between the EITC and various indicators or proxies of child maltreatment risk. So the first study by Rostad et al. Used nationwide administrative child welfare data spanning 2 decades, and they found that the presence of a state level refundable EITC was associated with a 11% decrease in the rate of foster care entries. The Clevens et al. Study used hospital admissions data from 27 states spanning 2 decades and found that the presence of a state level refundable EITC was associated with a 13% decline in rates of hospital admissions for pediatric abusive head trauma, which is a severe form of physical abuse that affects infants and young children. And then the Berger et al. Study used data from the Fragile Families Study, which followed longitudinally several thousand low-income single mothers after the birth of their first child. And this study found that an increase in household income via the EITC led to a decline in self-reported behaviors that approximate neglect, as well as a 8 to 10% decrease in self-reports of CPS involvement. So although these studies are still relatively few in number, they do consistently point to reductions in indicators of maltreatment associated with more generous EITC policy. So in the current study, we've tried to continue to build on this prior literature by considering whether state EITCs influence rates of reports of child maltreatment made to Child Protective Services. So we use data from the National Child Abuse and Neglect Data Systems Child File. This data set is typically referred to as NCANS. And the NCANS child file includes a record of all screened-in reports of child maltreatment that were made to state and local child welfare authorities in a given year. And screened-in reports are reports that were considered by agencies to contain enough information or evidence for further investigation. So these reports can come from either mandatory reporters, who are typically professionals who have frequent contact with children. So for example, teachers and social workers, healthcare workers, or they can come from voluntary reporters. And so NCANS is a really important data set because it captures the entirety of reports of maltreatment made across the United States, with some exceptions. For example, when states failed to submit their child welfare data to NCANS. So in this study, our primary analysis considered all reports of maltreatment, which meant that we considered both substantiated and substantiated reports as an indicator of maltreatment risk. We chose to include unsubstantiated cases since there are a number of studies that suggest that both groups of children face similar risks for multiple negative outcomes, for example, re-victimization, as well as poor and health and behavioral outcomes. So in addition to examining overall report rates, we also looked separately at rates by child age, broken into two groups. We looked at rates among 0 to 5-year-olds and 6 to 17-year-olds. And we were interested in looking separately at impacts by child age for several reasons. First, since parents with younger children are more likely to be experiencing poverty. Also, since younger children experience maltreatment at higher rates. And additionally, because there's significant evidence that early childhood is a particularly sensitive time for development and exposure to adversity. We also examined impacts on subtypes of maltreatment separately. So we examined impacts on rates of neglect, physical abuse, sexual abuse, and emotional abuse. And we had hypothesized that the EITC would be most likely to influence rates of neglect, given that neglect makes up the majority of cases, and that neglect is connected to poverty and parents' abilities to provide their children with basic necessities, like Ali mentioned, safe and stable housing or adequate supervision. So our analysis covered reports made from 2004 through 2017, and we used data back to 2004 since by that time, the majority of states were consistently submitting their data to NCANS. So in total, we assembled annual state level rates from over 42 million reports of child maltreatment that were made over the study period and across 50 states and DC. This figure here on the slide depicts variation in rates of overall reports across states in 2017. And it shows that there is considerable variation across states and report rates, which is surely due to many factors, but also may partially reflect differences in the policy environment at the state level. Okay, so as Aline mentioned, many states do offer an EITC to supplement the federal credit. And these state EITCs typically follow the federal credit's eligibility criteria and are expressed as a percentage of the federal credit. So just as an example, in this figure, you can see that in 2017, Colorado offered a credit at 10% of the federal credit, while Vermont offered a credit at 36% of the federal credit. And Vermont's credit is one of the larger credits. So a key feature, as Ali mentioned, of the EITC is refundability, which is really an important feature in terms of poverty reduction, since many low-income families don't have sufficient income tax liability to fully benefit if the credit were non-refundable. The federal credit is fully refundable, and the majority of state EITCs are as well. However, there are a handful of states that offer a non-refundable credit. So in this analysis, we only considered the role of refundable credits in reducing child maltreatment. And those are the credits that are depicted in this figure. This figure also depicts change over time in the number of states that offered a refundable EITC over the study period, as well as the percentage of the federal credit offered in each state. And the figure shows that over recent decades, many of the changes in state EITC policies were due to states introducing or expanding an existing credit. And there were only a few cases where states eliminated or reduced an existing credit. This figure also shows that states with an EITC are found in all regions of the country, as well as across the political spectrum, which likely speaks to the EITC's bipartisan appeal as a way to address poverty. So in our analysis, we controlled for a set of state level policies, as well as demographic and economic characteristics of states that may be associated with both state EITCs and rates of child maltreatment. And so therefore could be confounders that we need to control for in this analysis. So this figure depicts trends in each of those variables over the study period between two groups of states, those that did offer an EITC and those that did not offer a refundable EITC. So we found that most of these policies and state characteristics followed broadly similar trends, but there were some exceptions. So for example, states that offered an EITC were also more likely to offer paid family leave, as well as to have expanded Medicaid under the ACA. And these divergences could suggest that there are important differences between these two groups of states in terms of policy or political contexts, which are important to control for in our models. So this equation represents the regression model that we estimated to test the association between the generosity of state EITC programs and state level rates of reported child maltreatment. The state EITC variable is a continuous measure that captures the refundable percentage of the federal EITC offered in each state. And child maltreatment report rates are measured per 100,000 children. We estimated each model with our full set of control variables. And our models included state fixed effects, which essentially means that we included an indicator variable for each state that captures unobserved differences in states that didn't change over the study period. We also included year fixed effects in our models, which are an indicator variable for each year in the analysis. And they capture changes that occurred at the national level or were the same across states. And then lastly, we included state-specific time trends, which control for gradual changes within states that may be associated with both changes in child maltreatment rates and also with state EITC policies. So this figure depicts our main findings. We have three columns, one for all children, one for 0 to 5-year-olds, and one for 6 to 17-year-olds. And along the y-axis, we have overall maltreatment followed by subtypes of maltreatment. So there's neglect, physical abuse, emotional abuse, and sexual abuse. The dots represent the point estimates from our model, and the line running through the point estimate is the estimated 95% confidence interval. So this is an estimate of the change in the number of reports per 100,000 children that was associated with a 10 percentage point increase in a refundable state EITC. So we found that a decline in the overall rate of child maltreatment when we included all children of all ages, as well as when we separated children into the two age groups. And when we examined maltreatment by type, we only found a statistically significant decline in neglect. However, we did observe a negative association for other types of abuse as well, but these associations didn't reach statistical significance. We found that the decline in cases was greatest among 0 to 5-year-olds, but when we compared this change in the rate to the baseline rate for each age group, the percentage change in reports was very similar between the two age groups. And this is because the report rate is considerably higher among 0 to 5-year-olds. Okay, so I'll discuss some of the implications of our results. So first, I think our results suggest the important possibility that income supports can influence the conditions at the family level that may lead to child maltreatment. Second, our results suggest that the EITC may be effective at preventing maltreatment, particularly neglect, and really could play an important role because the EITC is able to reach families regardless of whether they have any current involvement in the child welfare system. This figure depicts trends in neglect, physical abuse, and sexual abuse over recent decades. And just to point out that rates of sexual and physical abuse have been multiplied in this figure to be on the same scale as neglect. In reality, they represent a much lower share of total maltreatment. But this figure shows that while rates of physical and sexual abuse have declined significantly in recent decades, neglect rates have remained more persistently high. And some have suggested that the differences that you can see in these trends reflect how traditional child welfare interventions focused on changing perpetrator behavior may be less effective for preventing neglect than other forms of abuse. And also that macro level factors like social policies may be necessary to prevent neglect, given the link between poverty and neglect. I also want to highlight the enormous costs that have been estimated to be attributable to child maltreatment. So for example, a recent estimate of the annual economic burden due to child maltreatment, just accounting for substantiated cases of maltreatment alone, reached $428 billion. So included in this cost estimate are both the short and long-term healthcare costs associated with child maltreatment, child welfare spending, criminal justice spending, special education spending. And so the magnitude of these costs make it more likely that effective interventions may be cost effective. Also, these costs speak to how health benefits and reductions in child welfare spending are important spillover effects to be considered when weighing the costs and benefits of social policies. And then lastly, I wanted to mention this really interesting recent study from which this figure here on the slide was taken, which assesses the potential role that state level policies can play in reducing child maltreatment, or I'm sorry, child poverty, and indicates that there is an important role for state EITCs. So these researchers simulated child poverty reductions that would occur if states offered the most generous support to families with children as is currently being offered in other states. So if all states were lifted to the highest level of benefits across the 4 largest income assistance programs at the state level. And they found that by adopting the most generous state EITC policy would have the largest impact on child poverty, reducing it by 1.2 percentage points. And I think their results suggest that the state EITC can play an important role in poverty and reduction in the United States, and therefore could also have a meaningful impact on child maltreatment. And so therefore, if states were to expand EITCs, we might see a decrease not only in poverty, but also rates of maltreatment, particularly neglect. So thank you very much, and I look forward to your questions. Thanks.
Thank you both very much for that presentation. Really interesting to think about these factors and how they impact poverty and neglect and child maltreatment. I want to encourage everyone to please put any questions you have for our presenters into the Q&A box. We do have one question to get us started, which is about the way that the EITC is structured depending on the number of children that you have. Can you talk any more about the difference in credit amount between having 0 and 1 child and 2, 3 or more children?
Yes, definitely. Nicole, maybe I'll let you take that on. If you go back to the structure of EITC, yes, which is quite a unique one, and it's by design, but I'll let Nicole discuss it in more detail.
Yeah. I think one of the important features is that the EITC increases, the credit size increases with number of children. And there's really the largest increase going from someone with no children to 1 child, and then from 1 to 2 children, and then from 2 to 3. So the increase gets a little bit smaller as the number of dependents increases. I think this reflects the assumption that there's sort of these economies of scale in households that, an additional child, there's less cost associated, fewer expenditures with care for an additional child. And that's how the credit is structured.
I'll add also to what Nicole said, that I have heard recently that there have been calls and parts of some advocates or other people to also see if some of these credit can also be increased for those without children. So that's something to see in the future to come. And secondly, I will just say and stop there by saying that now that we're on this slide number 9, do also take a look at the single versus married line. Interesting as you see that, at the maximum level, there's really no difference. But if you look at the dotted line for single versus the consistent line for married, you can see that the married one just phases out a little bit further down when you look at the earning and the x-axis. Otherwise, the maximum level of it you see is they collide, or they're the same. So just some interesting features of the program, which may change in the future, but these are by design for sure.
Great, thank you. A cluster of questions about looking at your own state. Jennifer asks, how would we assess our own state's quality of EITC structure? And a related question from Amanda, can we see which of these programs our state is engaging in at what level? And does each state have an advocacy center or organization that's working with state lawmakers to increase programs in their states?
Excellent questions by both Jennifer and Amanda. I'll make some comments, and then I'll let Nicole also share her thoughts. So yes, different states have different ways of going about providing supplemental EITC above and beyond federal. One of the advantages and unique features of EITC, which is wonderful, is that unlike some other programs, its uptake is quite high. And so while it's hard for me to provide like an exact number, but we know that above 70, 75%, 80% of eligible, sometimes in some states, they receive EITC. So which is wonderful for a policy, both from the public health and social policy aspects, but also in terms of research. It provides a really nice policy to look at. In terms of the quality of that uptake, however, and promotion of awareness about it, there is tremendous heterogeneity across different states. You are absolutely right. In fact, I think recently or last year, Robert Wood Johnson Foundation had a call for funding for individuals who would look at means by which we can promote awareness about some of these policies, including EITC, and make sure that its uptake is as high as it could get potentially, to really realize its potential. So I do acknowledge and appreciate that there are differences in those, and in your own state. I mean, it varies from one state to another. I can't comment on every single state, but yes, there are offices or entities that are charged with promoting awareness about EITC and trying to make it, as high quality as possible. Here in Washington, we have one. I'm sure every other state has their own office. But Nicole, do you have other additional comments on this series of questions about the quality and implementation of EITC?
No, I think what you mentioned about the importance of outreach and information about the program and uptake is really important, and not only at the state level, but also at the federal level. There is high participation or uptake of the EITC. I think it's around 80%, but that's at the federal level. And I don't think there's great information, at least available to us, about those numbers at the state level. But also just encouraging outreach information about the federal program is also important in addition to the state program.
And the federal one is larger as well, as you know, in terms of obviously the dollar amount. The state one is a fraction of that, as Nicole mentioned.
Okay, I think you may have just answered this, but just to be clear, we had a question about, did you factor the utilization rate into your analyses with the different utilization rates by state? Did I understand right that that wasn't something that you factored in?
Yeah, it's not something we were able, it's a really good question, but unfortunately, it's not something we were able to account for at the state level. There's really not great information at the state level on that issue. However, I will say there is an interesting paper that examines the impact of the introduction of a state EITC and how that influences take-up of the federal EITC. And the study found that the introduction of a state credit increased the number of people who are taking up the federal credit. So
that's interesting. So you can sort of multiply the effect of the state credit a bit.
Yeah, right.
Or,
exactly.
or leverage one another.
Yeah.
That's interesting. Thanks. We have a question from Carol. Do you have an understanding of what factors influence the improvements in state EITC provisions in the states that did make changes? And what are the lessons learned for future advocacy, and how your findings might best be used to encourage change?
Do you want to start with this one, Nicole, and then I'll go after you?
I'll let you start. I'm still thinking about the beginning of that question.
Well, I'll add, because I think, a similar question, which was, is child maltreatment prevention a salient? I mean, you described sort of the unintended benefits of these types of policies. Is that salient for policymakers? And how should public health advocates and prevention advocates sort of talk about these types of research findings in a way to influence policy?
Sure, yes. And I can see now Carol's question in the Q&A window, which is a wonderful and very broad question, really impactful question, consequential topic, which is, could be its own session. Absolutely. I think this is a good example, as you said, Sarah. Child maltreatment in relation to EITC, the reduction in rates of child maltreatment in relation to EITC, to put it very simply, makes sense. Meaning, even as I mentioned to you in the theory of change model, when I was looking at different types of violence, this particular forms of violence is the one that you feel like those causal mechanisms or pathways are pretty robust when you want to make a case that this may be impacted, especially neglect, as Nicole mentioned, in relation to social and economic policies. So Lessons learned. I mean, it's still, we are learning our lessons, but I think constant communications with practitioners, with policymakers, to keep them in the loop about what we are, for example, finding here in academic research is really critical. Here in our own state, we have been in touch with several colleagues to really make them aware of this. As you probably know, and Nicole, is it possible for you to go back to the map of EITC? I think the audience may find this kind of intriguing. Yeah, I think you just, there we go. You see that note? Washington's EITC has never been implemented, but would likely be worth 10% of the federal credit or $50, whichever is greater. And that's, you see that like sort of unique pattern there for our state here in Washington. We don't also have state income tax, but the reality is that it's just a dialogue. It's the constant dialogue, as you all know. And I think Carol is really highlighting this issue, whether it's advocacy or testimony or just having this conversation with those who are at the front line of practice and policy to see from their perspective what they believe would be the next important thing to talk about or to study. And so I think for this has been a wonderful experience, one that has made sense. I would say there's also the other side of the coin, if you will, which I don't want to talk too much about it, but there are scenarios when you look at, you try to robustly or rigorously examine an association between a policy and outcome, and you see nothing. You see no association. It's entirely null value. There's nothing there that you can actually show. I think that's equally important. We had a publication on EITC and intimate partner violence that came out in Injury Prevention recently, and we found no association. However we looked at it, whichever we looked at it, there was no association. And so you start coming up with, well, what would be the mechanisms that would explain this null association? And you engage in conversation with practitioners and policymakers to see what may be the culprit, for example. And so in that case, for example, we had some thoughts, and I don't want to change the topic because this is about child maltreatment this session. We had some thoughts about why that may be a null finding. There is no association, no benefit for EITC in relation to reduction of intimate partner violence and domestic violence. And then when we looked at some states, for example, Massachusetts, we found that Massachusetts actually had made some changes in their policy, knowing some of these deficiencies in the way that these credits need to be reaching victims and survivors. And we would expect that, something that Massachusetts, for example, has done in terms of the structure of the program may be adopted by other states in the future too. So that realization that there is no association there actually could be equally valuable for policy and practice. So I'll stop there.
Yeah, and I would also add to the first part of that question, which is that I think that health impacts of the EITC are becoming much more salient in policy debating conversation, and really trying to add child maltreatment, since we know it's such an important factor in health, could be important.
Great. Thank you both for those thoughtful answers. Someone else asks, what are the most challenging aspects of doing this type of policy research?
Oh, we should talk to Sarah about another session just to talk about the challenge. Well, it's 10:54 here in Seattle time. And well, then maybe I'll talk for 1 minute, 2 minutes, and then have Nicole also embellish on that. There are lots of challenges. To share one with you, how do you measure the exposure, as the epidemiologists call it? How do you measure the policy? There's so many different ways of measuring the policy. We came up with like 7 different ways of measuring EITC, from the most simple dichotomy or binary to the most elaborate ways of measuring it. What do you do with confounders or covariates? What other things, as Nicole so nicely mentioned, what other things were concurrently changing with EITC that may exert an effect on child maltreatment? And so you find something, you say, oh, it was because of EITC, had nothing to do with EITC. It was entirely because of those other confounders. So absolutely, there are many challenges. But as I said, this map you see here really is something that many researchers over the past several decades have used for different policies across the United States to really utilize that in a natural experiment fashion. I'll stop there. Nicole?
Yeah, and I think that's really well said. And also, I think you bring up an important point, which is that there are probably, these really important characteristics or aspects of policies that are more nuanced, that are really hard to capture in these analyses that, matter, but are difficult to capture in a quantitative model. For instance, like different states have different eligibility criteria. There's all sorts of, not necessarily with the EITC, but with other programs that might matter for child maltreatment.
Yeah, and related to that nuance, we had a question from a child welfare professional who says, we see that neglect is the most common but ambiguous abuse type, unlike physical, emotional, or sexual abuse, where some evidence can also be provided. These types of abuse coexist and neglect is added most often. Is the statistical significance in slide 21 due to this higher volume? Do you have thoughts on how that's factoring in?
Nicole, I'll let you go first.
Yeah, I think that's a really good point about how, so we're looking at maltreatment by subtype, but these aren't mutually exclusive categories. And so, as they mentioned, often these forms of maltreatment are co-occurring. It's a good question. I think we'd have to talk more with the research team about the implications in terms of the results. But I will say that there are other studies that indicate as well that neglect is being impacted in particular by the EITC. So I think it's important to sort of think of like the whole body of evidence as it emerges. Yeah, that might be an important way to think of the results.
I completely agree, and such a great question. Absolutely. I mean, when you look at that slide that Nicole mentioned with the point estimates, relative reduction, you can appreciate not only that neglect because of the higher volume, as the audience member asked, is just much larger. So you can get more precision, you can get statistical significance for neglect. So that's purely just statistically speaking jargon term. But then in terms of the actual substantive issues of it, which is what is the mechanism by which it may prevent neglect, that also makes more sense, if you will, for something like neglect in terms of the causal mechanism maybe than others, or at least it's more robust for that. So it could very well be because of that, as the audience member mentioned. And it's interesting that you say this because, like example I mentioned to you from JAMA Network Open for Medicaid expansion, also found the effect more concentrated for reduction of neglect.
Yeah, and I think that this also speaks to the importance of, for instance, like these large federal policy experiments that have been conducted. They haven't looked at, child welfare outcomes thus far, but that would, I think, those could offer some important insights if researchers were able to look at child welfare outcomes, because this is, sort of the best we can do is these ecologic studies at this stage.
Well,
but there would be better research designs for really understanding the impact.
Gotcha. Thanks. We have 1 minute left, and I want to ask you a really big question and just ask for just your initial thoughts on it. But in light of these findings, how are you thinking about how children and families are faring during the COVID pandemic and opportunities for prevention, and the economic strain that we're seeing around the country, and areas for future research and prevention work?
Nicole, would you like to take that on?
Sure. Yeah, so I think our work speaks to the importance of income supports during the pandemic. of course, the pandemic has increased material hardship, economic insecurity for families, and has also made them, of course, less visible to mandatory reporters. Yeah, so I think it's really important to consider the spillover effects of these income support policies during the pandemic. And I think, there's some nuance about the EITC in terms of like its ability to really promote financial and economic stability during a recession, given that it's tied to employment. So I think it's somewhat theoretically ambiguous whether the EITC on average, will be more, credit sizes will be on average larger for families, or whether it be smaller. But I think the larger point is that it's probably important that the EITC is not the only income support policy considered during a crisis like the one we're facing now.
Yeah, I completely agree, Sarah, and I don't have anything else to add.
Well, great. Well, thank you so much. Everyone stay tuned. At a later date, we will be able to share the slides in the recording, and there will be a publication forthcoming related to this work that we can also point you to. So really appreciate your time today, sharing your research to the presenters. And thanks to everyone who joined us today and shared great questions and really engaged in thinking about this together. So I wish you all a good rest of your day, and we'll talk to you soon.
Thank you very much.